Hello and welcome to Askimo TV. I'm talking today to Dr. Prasad Kothari. Dr. Kothari is a consultant ENT, head and neck surgeon in the UK. He has a special interest in head, neck and thyroid cancer and also in sleep apnea and snoring. Hi Dr. Kothari, how are you?
Good morning, John.
Dr. Kothari, let's talk about sleep apnea and frequently asked questions that people may have with regards to sleep apnea. So, what is sleep apnea and are there different kinds of sleep apnea?
Yes, sleep apnea essentially means when somebody stops breathing at night. Now, by definition, if somebody does that for what we call episodes of more than 5 times every hour, which leads to the oxygen saturation going down, then that is what we classified as obstructive sleep apnea. So there is obstructive sleep apnea, which is this, but there's also something called central sleep apnea, which is due to causes in the central nervous system. But that is a completely different physiology and a different part of medicine and treatment. Whereas the obstructive sleep apnea, which goes with snoring, is purely when people stop breathing or hold their breath at night for probably more than a few times every hour, which leads to oxygen saturation going down, but also as a result of that have got effects during their day-to-day pattern due to the lack of sleep.
What causes sleep apnea and who is at risk?
Again, sleep apnea is due to the structural problems. So if you have sources of obstruction, which may be the nose, where you have polyps in the nose or a deviated septum, that would cause obstruction, so that would cause snoring, but may also influence the apnea. Or when somebody is lying down and asleep, if the tongue base, which is very floppy, can collapse and cause narrowing of the airway, or if somebody has very large tonsils, so when they breathe in and out when they're asleep, the tonsils will move in and collapse the airway, causing significant narrowing. All these would cause stoppage of breathing and desaturations. Now, who's at risk? Usually we see sleep apnea in people who are slightly overweight. It is because of the bulk and the soft tissue of the neck. People who consume alcohol. So if somebody drinks, particularly before going to sleep, and drinks heavily, they will have increased risk of snoring, but also sleep apnea. Sometimes we see sleep apnea in people who are not fat or thin, and that is purely because of the structural anomaly or structural problems that they may have with a small tongue, with a small chin, a large tongue on a small chin, which collapses their airway when they're asleep.
How is sleep apnea diagnosed and what various treatment options are available?
Sleep apnea is diagnosed again on history because one needs to determine from the partner about the sleep pattern of the individual. But there is also a way of determining how sleep apnea affects the individual during the day, and we use a score called an Epworth Sleepiness Score, which is really a list of questions, and you score each question with a total score of 24. And the questions are like, do you fall asleep easily during the day? Do you fall asleep while watching television? Would you feel drowsy when you're driving or talking to people or as a passenger in the car? So if you add that up, it gives you a score. We all will score at least 8 or 9 on that because there are times when we all feel drowsy during the afternoon. But if you consistently have a high score of over 14 out of 24, that would indicate that you have got obstructive sleep apnea. So that's on history. Obviously, on examination, if you see somebody who has got a very large neck, and collar size is important. Usually an individual with a collar size of more than 17 or 17 and a half is at a slightly higher risk of getting obstructive sleep apnea. We would look in the nose and the mouth. If they've got big tonsils, if they have a large tongue, they're at risk. So these are simple tests, but there are specific diagnostic tests you can do. You can do what is called a sleep study or a polysomnography, where an individual will have a test when they're asleep. They're just essentially electrode which is plugged onto the finger and they are attached to a little machine. They go to sleep with it and it monitors the sleep pattern and it tells accurately about how many times you stop breathing, what your oxygen saturations did you snore, if so, how loud you snored. And these really are the clinically diagnostic tests for obstructive sleep apnea.
And what are the treatment options available?
The treatment options, depending upon if the obstructive sleep apnea is confirmed, we would classify that into mild, moderate, or severe. So if somebody has got a mild or moderate obstructive sleep apnea and they're overweight or they drink alcohol, then I think change in lifestyle would certainly help without any further intervention. If they have other areas of obstruction in the nose, either polyps or a deviated septum or large tonsils, then they can be removed. If you have a large tongue which is falling back, then there are some people who would advocate surgery on the tongue, but there are devices called the mandibular advancement devices where you wear a splint at night that brings your jaw forward like a brace and then improves your breathing. But the gold standard for treatment for obstructive sleep apnea is something called CPAP, where the individual wears a mask and attached to a little machine and that forces air into the lungs. And that would improve the quality of life considerably.
Would they have to use that long-term, ongoing?
Once sleep apnea is diagnosed, there are certain implications. For example, the individual has to inform the driving authorities. Certainly in UK, they have to inform DVLA, because if you have sleep apnea and if you're driving heavy goods vehicles, you are at potential risk to yourself and also other users of the road. So it is important that they get treatment for sleep apnea. Once they are on treatment, generally the treatment is for life. And these individuals who wear a CPAP machine will use it every night. They also have to take it with them on holiday. So it is a little bit of an interference with the daily life, but it improves the life quality so much that once they get used to it, they can't live without it.
Thank you, Dr. Kothari. Thank you so much for talking to me today.
Thank you.